everyone. I'm Dr. Rajka Tharath, and today I shall be discussing oral healthcare tips to help keep you and your baby healthy. Adopting healthy lifestyle early on in pregnancy will make a difference to your baby's health both before and after birth. So let's begin with healthy eating practices. A good nutrition from the mother is important during the fetal growth, as primitive teeth buds start forming about 5 to 6 weeks into gestation, and further development takes place in about 3 to 6 months. Around this time, a mother's diet should have adequate amounts of vitamin A, C, and D, as well as calcium, phosphorus, and protein. She should also be taking folic acid supplements in order to prevent neural tube defects. It's also very important to have a well-balanced meal having the right amounts of green leafy vegetables, fruits, whole grains, lean meats, and low-fat dairy products. You should also be drinking plenty of water containing fluoride to keep your own teeth strong. Try to have foods that contain high sugar contents, and the same goes for drinks as well during meal times. And try to find alternatives like plain water or even low-fat milk as healthy substitutes. Nausea during pregnancy might make it necessary to have several small meals during a day as opposed to 3 big meals. While doing so, try to have carbohydrates that are least processed like rice, fruits, cooked sweet potato, or even a smoothie. Make sure to read ingredient labels to avoid pesky additives. Avoid foods that are greasy, fatty, and spicy. Also try to have drinks which have cooler temperatures as opposed to warm temperatures, as these can trigger nausea. Also, you could try supplementing with vitamins like vitamin B6 or vitamin B12. However, you need to speak it over with your healthcare providers before starting any such supplement. Vitamin B6 became quite popular when the Duchess of Cambridge, Kate Middleton, used it during her pregnancy. You can get vitamin B6 from foods such as avocado, bananas, pistachios, and sunflower seeds. Traditional remedies include teas or drinks which are made with infusions of ginger, mint, lemon and honey, and spices like fennel, clove, cinnamon, and nutmeg. Going back to ginger, an ideal amount to consume during a day is 1 gram of ginger. And if you're prone to hypertension or taking any kind of medication, then please proceed with caution. Pregnant women are also advised to go for prenatal vitamins which contain iron, which might exacerbate nausea. So try taking it at bedtime as opposed to taking it in the morning on an empty stomach. Also, while going for these prenatal vitamins, avoid the ones which are in chewy or gummy form, as these have a lot of sugars and are sticky in nature, especially if you're taking them after brushing or at bedtime. For women who have a caries-prone mouth, please consult your oral healthcare providers about the use of xylitol lozenges, as research has found that a regular use of xylitol by mums has reduced the transmission of caries-causing bacteria to the newborns. So now that you are choosing the right foods, avoiding the wrong ones, and making healthy choices as a way of life, it's time to make your mouth your top priority. Please make sure to visit your dentist every 6 months or more if indicated. It's absolutely safe to undergo preventive and restorative treatment throughout the course of your pregnancy. It includes fillings, dental cleaning, radiographs, as well as pain control medication. While taking radiographs, the dental staff will provide you with a lead apron to cover your torso, as well as a lead collar to protect your thyroid. Pregnancy presents itself in the mouth with unique conditions like pregnancy tumor, which is a soft tissue outgrowth in the front area of your gums. This usually subsides once the pregnancy is over and the hormonal surge comes down. Also, conditions like gingivitis, which are characterized by red, bleeding, and painful gums, And if these are not attended to at the right time, they can progress on to periodontitis, which is a more severe form of gum disease involving bone loss. While making a dental appointment, make sure to let the dental staff know when you're due and how far along are you into the pregnancy, as well as any special recommendations or advice from your obstetrician or gynecologist. This will help the dental team to schedule as well as make your visit more comfortable. Last but not the least, your oral home care routine. You must adhere to a strict oral home care routine even before you decide to get pregnant. Make sure to brush your teeth twice a day, after breakfast and before bedtime, using a soft power toothbrush and toothpaste which contains fluoride if you are caries prone, or if you have periodontal disease, then go for the ones which are labeled anti-plaque and anti-gingivitis. Use a mouth rinse once a day, preferably at night, as well as try to floss at night. While flossing, do so gently so as not to traumatize the delicate gum tissue. For those who are struggling with morning sickness, unfortunately it can hit at any time of the day, and it causes the stomach acids to make way to your mouth where they attack the teeth and damage them. So, after a bout of morning sickness, please refrain from brushing right away. What you can do is swish and rinse with plain water or water with the diluted mouth rinse containing fluoride, or a mixture of water and baking soda, that is 1 cup of water and 1 teaspoon of baking soda. Swish and rinse, and you can brush after about 30 minutes. If brushing makes you gag at a time when anything and everything can possibly do so, take it slow and try to figure out what actually works for you. It could be something as simple as changing the flavor of your toothpaste, using a toothbrush with a smaller head size, or even brushing at a different time of the day. Even while brushing, if the gag reflex gets triggered, just stop for a moment and swish and rinse with water and then try to resume. Whatever you do, try to keep up to your oral hygiene routine, as though it may not seem like it at that time, but when a mother is brushing, she is brushing for two. Coming to the end of our discussion, there are a couple of questions which I get asked frequently, one of them being, can my unborn child take away the calcium from my teeth? No, it's absolutely not possible. During pregnancy, there is an increased risk of demineralization and cavitation because of several changes taking place at the same time, like changes to your dietary pattern, changes in your oral home care routine, as well as morning sickness and nausea. The other question is that is it normal to lose a tooth during every pregnancy? No, this is also an old wives' tale, and losing a tooth is not a normal part of pregnancy. And if you did end up losing one, it's probably because of an underlying pre-existing dental problem. And so, I cannot stress enough the importance of visiting your dentist regularly. Please do not put it off for until after the baby is born. Also, please avoid alcohol consumption, tobacco use, or any kind of substance use, as this will help to keep your baby safe and healthy. So mamas, use your preventive powers wisely and stay tuned in my next episode for oral healthcare tips for infants from birth to 1 year. In the meantime, keep smiling and namaste.